Welcome back to The Change Physician. I am Melissa Katie, the Challenge Doctor, with my co-host, Dr. Kevin Cuccaro, I say co-host from the West Coast. I missed that. Out of practice. It's been a few weeks there, Kevin. I think we said it was the 13th of January since we last talked. But for those of you that don't know what the Change Physician is all about, you should go to thechangephysician.com, learn a little bit about us and what our intention was and is about this community. And if you want to join the community, you can be a physician or a physician ally, and we'll be happy to have you along the journey. So our Saturday salutations or Sunday salutations are typically just to catch up for Kevin and I and share what's going on with the podcast, if we have any new episodes, and any other news, current events that we feel like talking about. So, all
I'm
right,
almost
how are you
done
doing?
here. I got
Done
one
with your
more to
thing?
post,
Okay, very good.
and then
Let me see. So we typically will release these on YouTube, and we'll go into the podcast anytime we have our Saturday salutations, in case anyone that's on Facebook didn't know that. So we kind of keep things flowing a little bit.
wherever you want to consume or listen to us rant or rave or whatever. I think it's I guess it's one of those things. It's like we do this more for fun than anything else. We are definitely not the professionals. Professional podcasting. This is a lot of work to do all that stuff.
It is.
So, yeah, 13th. Let me just tell you. Uh, I mean, a lot can happen.
Oh boy, I'm curious. Now the not just the audience, but myself, I'm curious, what is the excitement over the last.
Yeah, so Saturday the 13th, up until let's see what we talk about. We talked about the new year. We talked about, I think I talked about my wife's thyroidectomy, which she had a total thyroidectomy done at the beginning of the year, which was good. She has Hashimoto's thyroiditis and had been getting a enlarged thyroid and it was getting uncomfortable. Had a bunch of biopsies on it, and they all came back just Hashimoto's. So she's finally decided she was sick of it and wanted to get it out. So she had that done. And then we were like raring to go. This was a big year. I had so many, I had literally flights to, we had a trip to Palm Springs this month, trip to San Francisco in April, trip to Chicago in May, a cruise to Alaska in June. Yeah, so we were just like, I had flights playing, but we were just going crazy. Cause both of our kids are now in college, and we were kind of like, all right, let's do all the stuff that we never got to do because we got married. When did we get married? Third year of medical school. Yeah, we got married in training. So all these people had like this, these honeymoon periods, and we were like, okay, we're in the middle of clinicals, and then we did internship, and then we had kids, and then we had residency, and we had another kid, and so it's been very busy. So we were looking forward to that. But let me just tell you that everything can change in a second, because on Tuesday, January 16th, so right after Martin Luther King Day, we get a call from the surgeon, and they're like, "Did you check the path?" And we're like, "No, why would we check the path? We wouldn't even think of anything on the path." And it came back with a diffuse large B-cell lymphoma. So,
Wow.
yeah, let me tell you, your life, we talk about it all the time, about how your life can change so quickly and suddenly. And it does. And it's just another reminder there. So, anyway, our plans have dramatically changed. And
Wow.
it has been an incredible couple of weeks. That all being said, after the end of the full workup, it's aggressive. I mean, most B cells are fairly aggressive. But the pets came back, all her lab work came back. She's like, great physical status. Her blood work was all normal. There's no signs of like massive amounts of metabolic activity anywhere. Her PET scan came back with some kind of equivocal stuff in the cervical chain, which we knew about. It wasn't quite positive when you kind of look at how they graded on a PET. And then it just lit up the bed of the where the thyroid was. It kind of looks post-surgical, so that looks good. So as soon as we get treated, I mean, the prognosis should be good as anything can be, we just have to get through chemo. But yeah, it's been crazy, and it reminded me again of a couple of things. One, how lucky, like, you went to medical school, and it's hard, and practicing is, can be very difficult, and there's burnout and everywhere. But let me tell you, the knowledge that you have is absolutely indispensable. And I just can't even imagine navigating this without knowing what I know. I just can't. I mean, I mean, it was hard enough. I mean, and it was super hard. That first week was like, I can't even begin to tell you, but at least we knew, and I knew where to look. And my wife and I do things differently. She kind of was like, pulling back a little bit. She didn't want to necessarily look in the details, which I can see. I want to know everything. So I'm like reading everything. And then you're like, okay, we got the healthcare system. And like this is the stupidest thing. We have this big diagnosis. And the only thing I can think about was how is the healthcare system going to screw this up? Right. Because nothing, unless you're bleeding out on the street somewhere, nothing isn't a priority, or at least that's kind of what I felt a lot of ways. And, we're waiting. The surgeon put a referral into the oncology group, one of the local ones up in Portland. And we waited literally 2 days. And I'm like, we're not waiting anymore. We got to get the ball rolling. And we knew to push, right? Because I knew about the lymphoma subtype. I knew what at least the first steps. Obviously we're not oncologists or whatever, but you can read data. It's not that hard. And we just started pushing, right? So we called our local oncologist the morning of, I think it was Thursday. They got us in that afternoon. We got the ball rolling with all the staging things that you want to get done, because you really want those done in about 2 weeks. So we got all those going on. And then we're like, well, maybe we should see a lymphoma specialist in addition. So we called up the Oregon Health Sciences, which is in Portland, which is it's like 90 minutes away from us. And let me just tell you, as an academic center for their oncology department, they were freaking amazing. They were, and I didn't get I don't think they knew we were physicians or whatever. This is what they did. They called us. They were aggressive about getting us in. They helped us make sure that, because it was supposedly out of network. And just like, you need to try to get this in, try to get this. We want to, if you can get it in by blank, like, so it was, let's see, called them on Thursday, and they got us an appointment for the following Friday, which was fine because we already had started all the process of getting the PET, getting the MRI, getting all that done. And but they were really, really, really good. Then our own insurance, and I'm going to call them out. So and it's not necessarily their fault per se, but we have Providence Health Insurance. And so we got our surgery done at Providence Health System in Portland. And those people, in whoever their oncology department is, whoever their scheduling people are a bunch of clueless clowns, like clowns. So they call, and actually no one ever called. And my wife calls them and said, hey, we had a referral placed in. And they're like, oh, we're waiting for paperwork. We're waiting for approval. And we're like, well, we don't need approval. So she calls our insurance company. They're like, you don't need approval. You just schedule. So we call back and they're like, oh, yeah, I guess. Okay, maybe. Let me see here. We can get you on February 15th. That's almost a month out from when we got the diagnosis. I'm like, are you freaking crazy? Actually, I didn't say it like that. It was a little bit more bit more obscene, I would say.
Yeah.
And I mean, they were so freaking clueless. And all I'm thinking, because by this point we'd seen our local oncologist, we already had the setup with Oregon Health Sciences, who again were amazing. How many people out there don't know what we know? We're waiting from a call from a department that didn't even know that they didn't need approval because of the insurance, right? So that when you did call, we're like, don't look at any of the subtypes. Don't look at the reason of the referral. I mean, there's things that you can wait on along things that you don't want to wait on, and most of the cancer ones you don't want to wait on. But things were aggressive. You don't book them out a month when you haven't even done any of the testing yet, right? You need to get that staging done.
Yeah.
So, man, I'm still infuriated. Like, I'm so mad about them. because I just think about everybody who doesn't know that you need to advocate for yourself and that the system is not designed to take care of people. I mean, the docs that we've seen have been fantastic. The staff in general is good, but we continue to have to push to get care. Like our last one is just to get the chemo started. So again, our insurance is doing some stupid thing, and then they're like, and we're like, we finally, because we saw our oncologist on Tuesday, and they were coordinating with a lymphoma specialist. We kind of knew what the regimen was going to be because the data kind of says it's going to be R-CHOP, which is not anything new, and it's not expensive. It's not some weird experimental drugs. And they hadn't called, so we called them yesterday, and they're like, this blah blah blah, and this should be from this person. I'm like, there's nothing. What are you guys doing? We have the orders. Oh, well, they don't know if it's OSSU. And they were getting confused because we had the second opinion at Oregon Health Sciences, and we have our local oncologist who's ordering the chemo. And they can't even figure out the difference in the orders there. And then you're like, okay, well, once that clears, when we need 3 days, it's up to 48 to 72 hours to authorize this. And I'm like, is it business days? Because now it's Friday. And now you're telling me that, we're looking at Wednesday or if everything goes well. Yeah. So anyway, we're going to get started next week because we will push through this. But again, it is absurd. It's just absolutely absurd. And like, I know these people it's hard, and everything in healthcare is always pressing. But man, I just, I don't, it's hard enough. And we're 2 physicians. I can't even imagine what it is for anybody else. I literally just don't understand that. But anyway, so that's what we've done for the last couple of weeks.
Oh my God. I am so sorry to hear that diagnosis, first of all. What is just for the benefit of those listening, what is you said CHOP, something before CHOP, what it was?
R-CHOP.
So how long is the journey of the chemo planned to be, you think?
Yeah. So lymphoma is actually kind of interesting. So like a B-cell lymphoma, and there are different genetics. It actually was kind of, from the medical standpoint, it was actually fascinating when you're not worried about your family members. I'm like, holy wow, look at all this stuff and all these genetic markers that they're looking at, and they run all these little profiles, and they're finding what's being expressed genetically on these tumor cells. Anyway, some of them have better prognosis, some of them don't, some are more aggressive. We haven't really been able to target them well yet. There's some new experimental stuff. And then my wife's fits, like, it's not the aggressive but pretty chill one, and it's not the super aggressive one that you definitely don't want to have. It's kind of in between. But CHOP is an old regimen, and I can't remember it doesn't matter. People can look it up. It's been around for like 40 years. And then rituximab, which is one of those antibodies, they added about 20 years ago, and that has dramatically changed or improved the outcomes with a lot of this stuff. Yeah. And then the other thing that was, so it's, depending on whether they're spread above or below the diaphragm, side of the tumor, and everything like that. And again, my wife, who's very unique in all different ways, decides to do this uniquely. So this is primary thyroid lymphoma, which is rare. And then again, some of the markers are different on her versus somebody else. If the tumor her thyroid was large, so this was greater than 10 centimeters, so that's what you don't want, but there's really nothing else anywhere. So all the data really says just, you're going to do R-CHOP. It's going to be 3 cycles. There's a debate on whether they're doing radiation or not. That's where the center is going to get back to us, because they're going to talk about a tumor board. But it more likely is going to be probably 4 cycles of R-CHOP. And other than you don't ever want this, and having to get through the chemo and all that other stuff, the prognosis is pretty good, I have to say. Like, that is, you never want it. But if you're going to have it, then kind of looking at, again, the data, which is what I always look, what's the data say? What does the stuff say? And it looks pretty good. We just need to get started on it.
Yeah. How long is each cycle?
So they're 3-week cycles. So you go in and you have an infusion one day, and then you wait 3 weeks, and then you do an infusion, and then you wait 3 weeks and do an infusion. So we should be pretty much over the hump. Well, certainly by June is kind of the goal, to kind of like be done. hopefully, and then be on full recovery, depending on how everything else goes.
Yeah.
So,
Hmm.
yeah, it'll be interesting.
Man.
But, yeah. I mean, and then you also think that the other stuff is, um, Kim, we are so lucky. I mean, it just makes you appreciate. We have, I have a great family. They don't live close by, but they're here. We're not here, but they could be here. We have
Yeah.
good friends who immediately were like checking in as soon as we talked to them. Again, we're physicians, so we kind of know what to navigate. We actually know some of the people who are working in the cancer
Mm.
center. Some people may not like that. I like it. You want to have a connection.
Sure.
We got the port and scans done really quick because I hate to say it because we know people, and I like to assume that everybody would get that as well. I'm not going to not use what we know. But they were super accommodating, and yeah, so we're really, really lucky. And then the other thing I think is we had we both worked, and we're fine financially. So my wife will be off for at least 6 months, but we have absolutely no financial worries about that. And that was the other thing. Like, she was like worried about it. I'm like, we're fine. We have literally, you don't have to work. We're going to be totally okay. This whole thing. And yeah, so we just have to stress about the cancer. I mean, and that's the stress enough. And so again, I think about other people who go through this and don't have resources, may not have family. Because of my chart review with my job, I see so many people that are going through pretty significant health issues and this have no support.
Yeah.
Um,
Or single income and they don't
or
have
single income, and we got this crap system that is just. I mean, it is. I know it's people talk about American healthcare is the best in the world. It's not the best in the world. You have to be able to take care of people, and you have to be able to take care of everybody. And way back when we talked about the veil of ignorance, I think it was the veil of ignorance on how do you design a just society. And the veil of ignorance is the measure of a society is one that you will join, like you would, without knowing where you are, from being a prisoner to being a billionaire, that you would say, that's the society. I'll be fine in that society. Like no matter what the random draw says, again, you can be in prison or not. That's how you measure a just society. And it goes for healthcare too. If your healthcare system doesn't serve everybody, then that's not a just healthcare system. That's, and we're not a just world or whatever, but you should be working toward that.
Right.
And people shouldn't have to be pulling connections, and people shouldn't know this stuff. It should be designed that you're helping people.
Yeah.
And anyway, it just reminds me of that, and the fact that so many people, I just feel like they're sheep to the slaughter going through this stuff.
Yeah.
It's like scares the crap out of me.
And I wish there was a way for, I think of several different ways in which, you always think of what to put out there in the world, what the world needs, and it's hard to change an already embedded complex medical system that's not favoring the patient, favoring the pocket or dollars more so than anything. But I try to think of all the different things that we can like education and provide, but it's such like a moving target. Like it's really hard to kind of like even if we were to put a little book together on helping people navigate the system, like how do you frame that to like really help them? It's like in the moment you have to like problem solve. And unless you do that physically and trade your time for money to help those people, it shouldn't be that way.
It shouldn't. And it's hard because the system is getting taxed. It can't do what it needs to do because there's so many things that it's doing that it shouldn't be doing, I guess is the way to say it.
Yeah.
Like
unnecessary or repetitive.
Repetitive nonsense. And it's incentivized. Obviously, everything is incentivized to make money, right? So that's why you can't see your primary, because they're booking out appointments 8-12 weeks in advance, right? Because they can't have an open slot to actually see somebody acutely. God forbid that, because an empty slot, if nobody shows up for it, is lost income and revenue, right? So then we have the urgent care. And the urgent care is supposed to be seeing the overflow or acute things, but they end up serving this role where they're actually basically kind of doing primary care, but acute primary care, because there's nobody following their patients long-term anymore.
Right.
And that is nonsense.
Yeah.
Chronic, like in most if you've got hypertension or diabetes, you do not need to be seeing your physician every 6 weeks unless it's so brittle that there's some complex changes. mean,
Right.
we should be doing group appointments for those. You don't need to be seeing a physician. Again, you could be seeing, a mid-level provider and maybe a group appointment where you're just kind of checking and kind of managing it.
Yeah.
Um,
Direct
there's
primary care.
well, in you can't do direct primary care with everybody because there's not enough access. So even
Yeah.
if, I mean, that's the problem with that. And then so many people don't know how to take care of themselves. And we have active industries telling people that basically normal signs and symptoms are pathologic and you need to be on a drug for it. And God forbid people that we focus anything on exercise and movement and dietary changes because that'll do 80% of the workload. And then just being able to do emotional regulation and stress. People just understanding that when you are anxious, it doesn't mean you need a pill all the time.
Yeah.
That anxiety is a normal thing, and that there
Especially
are
in this
tools
world we live in.
in this world that we live in, and that's just telling you that there's danger, and then what do you need to do to actually help yourself feel better? And there's ways to do it without a pill, and if we could do that stuff and kind of move away from this idea that we have to take care of all the stuff that we really don't necessarily need to have a heavy intensive load with, that people, if people learn how to take care of themselves, learn how to take care of yourself, then for the stuff that the medical system should be really, really good at, trauma, and I'm talking about like necessarily bodily trauma, cancer, the other ones, I can think of bad examples for almost everything. So it becomes really, really difficult to kind of pull. We're really good at acute conditions, and we're getting better when it comes to oncology as long as we actually follow data and not put people on stuff that has really no great benefit.
Sure.
It'd be better, yeah. But
Yeah.
I don't know how that's going to happen. And like you said, there's no quick fixes with that because there's so many different things to address.
Oh yeah.
How many people are going in who don't have basic life skills? Things that you think everybody knows. And I think that's one of the hard things about medicine is you got to take this population that's so educated and really probably should, I'm not sure if everybody does, but should know basic healthcare or self-care kind of strategies and emotional regulation, the ability to show up every day and to do self-management, how to actually function well. And a lot of people never learn those skills, and there are no resources to teach them that. And then they get sicker and sicker and sicker. And then they're in the healthcare system when they could have not been if we had actually addressed this upstream more. But that's a societal issue.
Oh, yeah. I mean, my brain was going into all the societal issues, and last month I've just really like somehow gotten down the rabbit hole of even just watching how irresponsible and cruel and mean people can be to just dogs. I mean, and there's hundreds of thousands to millions in every city. Like, I mean, Tijuana, all these places trying to rescue places, and you're thinking, why are people projecting this evilness or anger to an innocent dog or puppy
or a
kid, like, or another adult?
Yeah.
Like, I think to myself, like, there is intrinsically a societal issue in us taking responsibility and having a self-awareness. We always talk about that, about like what is driving us, and people don't truly understand. It's always so easy to project on others that they're the ones at fault and no one taking responsibility for themselves. We just had a discussion with a police officer not too long ago, and just how a family member is blaming the moon for their child not being well behaved. And I'm like, just thinking, like, what does this world come to if we can't even like understand that we all affect each other? And why? And then it made me realize when I was younger, I remember hearing people say, all we need is love in this world, or just be kind. And it just seems so just general, but deep down, it's half a century into my life, I realized that is really simple, but it's really genuinely true. If we could just all operate on that level with an awareness that we are affecting everyone, whether you cognitively are aware of it or not. And it's hard to watch.
Intricately intertwined. And
Yes.
I'm definitely guilty of that, of not being aware and being a little bit more compassionate I'm fairly impatient and rageful. Uh,
You know when you become rageful, but
I do, and yeah, I, and at least I kind of I don't like cruelty. I really dislike that, and I hate bullies, and
ugh, it's
um,
so painful to.
but it does part of it, it does come back to that whole saying about hurt people,
Mm,
and I don't know, but
I
needless to
think,
say, there are many problems in this world, and
yeah.
we just talk. I'm not sure if we're solving anything.
No, but I mean, I think honestly, a lot of people just sit here and talk about problems. And I've been thinking about the things that I get passionate about just recently and how to make an impact and make a difference. And it can be overwhelming when you really deep down think about the problems we have and how can one person change it. And you realize we need a community. So we need to, like you said, we're very intricately connected, but that's why communities can, lift up things or change things in this world. But many of us are just trapped in our own little lives and not, little, I can say little, but, we're just day to day surviving in this stressful world and trying to keep to ourselves more so than we ever have before, I think. Um, but even you just said with what, your wife's diagnosis, those relationships and connections just happen to be also beneficial when you're navigating in the medical field too. Like you need connections to lift you up or support you when you go through things. And I even your collegial relationships are critical for that too.
No, no, no. Connections are huge. We're definitely a tribal society, good and bad.
Yeah,
Um, but
that's
yeah,
value. I mean, look at the people that are what does wealth mean? Like, is it really money or is it the relationships you have? I mean, your value is not just the money in your bank, it's the connections. And some people get paid just because they have connections. I mean, look at
yeah,
us
yeah. What
masterminds.
Tim Ferriss used to say when he said your network is your net worth,
Hmm.
and you can kind of think about that as your I mean, in the networking sense of actually having real connections, because that's like there's people who network and are just basically using people. The smart people are actually having networking where they're actually growing together, and that is definitely powerful. Because again, yeah, our network has been amazing, and yeah, we're just very lucky on
Yeah.
that. And there's
Yeah.
a lot of people who don't have that, and I don't know, it's harsh, it's harsh,
Yeah.
but.
Yeah. Well, anything else over the last couple weeks? I assume this has been all consuming.
Yeah, it's been pretty busy. Again, lots and lots of reading. It was an interesting emotional journey, kind of go through it. And I think the next stage is when we actually start chemo, then we'll start a new cycle. Because right now, I think we're kind of like, you got to get through the hump and then kind of know what to expect, or at least what's coming. We don't know what to expect until we actually do it. Um, but yeah, anyway, it's been interesting. I do have to say, literally the day before we got the diagnosis, I was going a little kooky and I
Uh-huh.
bought I booked two cruises. So and like we hadn't even taken the one in June. I'm like, oh, I want to do this one, and we should leave from Vancouver because apparently leaving from Vancouver is better than Seattle when you're going to Alaska. So I booked an
Mm.
Alaska cruise in April of next year, and then I don't know what I was just going crazy before we got this. And then I booked another one from Hawaii to that was coming back from Hawaii in May of 2026 because Princess Cruises, you can book the cruise and it's a $200 refundable deposit. So I'm like, what the hell? Why not? Why don't I just book all this stuff?
Yeah.
And if the price goes down, I'll book it cheaper. And if we have to cancel, I'll have to cancel it. But anyway, so it's been an interesting year thus far.
Well, when you schedule it, it gives you something to look forward to. So
Oh
it's,
yeah,
I'm
yeah,
sure a part of that.
yeah, yeah.
Yeah.
Ready,
Well,
ready to get through this.
yeah.
Ready to be
Well,
done.
I think over the next few months, whenever you're wanting to, and you should keep us posted on how things are going.
Will do. I
The
think
lessons learned.
I don't mind talking, that's for sure. I got permission from my wife, so it's not like I'm sharing
Oh,
anything that she's not
that's nice.
um that she was not willing to do. But yeah, I will happy to explain that. I mean, I will say the one thing, because anybody who's been listening for no, I'm super jaded. I'm a very jaded individual, and perfectly when it comes to healthcare, I'm super jaded. But I was just blown away.
Mm.
Um, Again, when we called the local oncologist and we talked to the scheduler and said this was going to, and they literally got us in like, I think it was about 3 hours after we called, 4 hours after we called. And then having the health center up in Portland, which is it's an academic, they're busy, busy, busy. And to get us in and then just work so hard. I mean, these people have been amazing. And so there are little gems, and I think there are a lot of people that I tend to forget about, that there's clinicians out there and there's schedulers and there's RNs that are really, really doing good things. And
Yeah.
that made me happy. I just still am pissed at the system.
Sure.
But people, the little bright spots in this kind of mess of stuff. So
Yeah.
yeah,
Well, I'm glad that there's when people just finding those gems that truly care, especially personally, that when you need that care, um, it's just like priceless.
it is. It is. So
Yeah. Well, I feel like I want to keep this the focus of our conversation, and I don't have too much to add over the last few weeks. Nothing that's exciting enough to share. um, but maybe I'll bring up something um, coming up on the next one. But yeah, are you okay with that?
I'm okay with that. Yeah, I'm okay
Okay.
with that. So.
All right. Well, you want me to just take us out?
Well, I just want to add for everybody is I started with this, I'm gonna end with this again. You literally don't know what's gonna happen tomorrow.
Hmm.
So while you're planning, and we talk about like, retirement and saving and all that stuff, um, is just realize that everything can change. So make sure whatever you're doing now is also bringing you joy.
Hmm.
Um, don't be a hedonist and spend all your money and have no resources, because that's bad. But really understand that while we're planning for the future, you got to enjoy what you have now, because it could literally change. It could
Yeah.
literally change overnight.
Yeah. Spread your wealth for now
Yeah,
and later.
yeah.
Yeah. Well, thank you for that, Kevin, and send our love and wishes and support through the internet to your wife. And hopefully we'll get out there to Oregon one day, get to see you guys. But until next time, for those of you listening, if you want to send any messages to Kevin, is it Dr. Kevin at thechangephysician.com?
Dr. Kevin at
Okay.
thechangephysician.com.
You
Yeah.
can send messages to him or to me through him. And if you don't know, again, what the Change Physician is all about, please go to changephysician.com, and we'll look forward to talking to you on our next visit. Take
Stay well,
care.
folks.